Good morning, everyone. On behalf of the entire BC Transplant team, it's a pleasure to be here today. It's always exciting to be part of an event where healthcare professionals from across the province come together and learn from one another and strengthen partnerships with a focus on patient care and patient outcomes. Today I'm going to share some of the updates for the last year with BC Transplant, our current priorities, and some of the most recent data we have on donation and transplantation, and of course with a focus on kidneys. So I'd like to start with a reminder of our role and mandate at BC Transplant. Our mandate is to ensure that every potential living donor and deceased donor, if suitable, has the opportunity to donate, thereby increasing the number of organs available for transplant. To accomplish this, we focus on three areas: increasing organ donation, reducing the number of patients waiting for transplant, and improving how we deliver care to patients and donor families. These goals go hand in hand. You increase the number of donors, you increase the number of organ transplants, and decrease the wait list. Sounds like simple math. Unfortunately, it's a little more complex than that. You're probably familiar with the transplant side. BC Transplant also works across the continuum with organ donation at the core of our mandate. 10 years ago in BC, we had 32 deceased donors. It was one of the lowest donation rates in the country, and we realized that something needed to change. So to inform a strategy and reverse this trend, we conducted national and international environmental scans to identify what the characteristics were of high-performing organ donation organizations across the country and internationally. What we identified is we had two foundational pieces: an organ donor registry and required referral legislation. And on that foundation, we focused on 5 key elements to improve organ donation in the province. Firstly, public awareness, which is the foundational element in building understanding and support for organ donation within our communities. Secondly, donation experts and champions. We've created a province-wide network of donation specialists, in-house coordinators who work collaboratively with donation physicians and regional hospital-based critical care teams to support organ donation at the hospital level. We've created partnerships with the critical care community, support healthcare professionals in offering the option of organ donation as part of quality end-of-life care to avoid any missed donation potentials. And more hospitals within the province can now offer organ donation as an end-of-life option. Last year, we had donors from 22 hospitals in British Columbia. We've helped develop and have adopted national best practices and leading practices, which I'll talk about in a few slides. And lastly, we've expanded programs by really adopting and creating innovative ways to advance our capabilities to have more organs available to save more lives. On the public awareness side, BC has a robust communications program, which was active and in full force in the first ever Green Shirt Day. This was launched as part by the parents of Humboldt Broncos player Logan Boulet in conjunction with the Canadian Transplant Association. Green Shirt Day was held on April 7th, the one-year anniversary when Logan became an organ donor. It was a huge success, and many healthcare professionals, community groups, and workplaces took part in the province, and it was a huge success nationally. And it is going to be an annual event, which we hope will continue to gain momentum right across the country. Green Shirt Day is one piece of a much broader program to expand public awareness and community outreach. We can only do this with the help of more than 200 volunteers around the province, most of them being transplant recipients, donors, and deceased donor families. Highlights from this year include our inaugural Walk of Life during National Organ and Tissue Donor Awareness Week. That brought deceased donor families together with recipients and living donors. A shift in the look and feel and tone of our annual advertising campaign to capture a more media-savvy audience. And with community events, we've more than doubled them this year. We've had over 105 of them, and we've logged over 770 volunteer hours from our volunteers, which is quite remarkable. And the results, I think, speak for themselves. We're close to 1.5 million British Columbians who have now registered as organ donors. And in the last year, we received over 150,000 additional registrations, and that's a 10% increase over the last year. As I mentioned previously, one of the key elements of high-performing organ donation organizations is standardized care and implementing national best practices and leading practices. We've worked very closely with Canadian Blood Services and other provincial partners across the country to standardize guidelines, identify leading practice, and apply them here in British Columbia. The first few are foundational, and the latter are more innovative and include heart donation after circulatory death, donor identification systems accountability, which really looks at missed opportunities within the intensive care units, organ donation and the consciously competent patient, including MAID patients, and interprovincial organ sharing, the most recently being the creation of a registry to share highly sensitized hearts across the country. Last May, BC Transplant was one of 3 organizations asked to present to the House of Commons Standing Committee on Health when they were seeking input on organ donation and transplant systems in the country. The committee released its final report in the fall of 2018 with a number of recommendations and implementations through the Canadian Donation and Transplant Collaborative. The collaborative was established to inform thinking and encourage ways of facilitating and supporting collaboration amongst federal, provincial, territorial governments, Canadian Blood Services, and key organ donation and transplant stakeholders across the country. 8 working groups have been formed. We at BC Transplant have representation on all of them, and it's really been an exciting process nationally this year, and we're looking forward to the outputs of this in the next few years. In terms of new opportunities, while we're really very proud of what we've achieved with our province, as we all know, we continue to look for ways to go even further. The science of donation and transplantation is always evolving, and we aim to adopt these changes into new programs and technologies, including the Transplant First initiative introduced to this group last year, has been underway to improve the rate of preemptive kidney transplants. Living donor referrals have gone up since the program launched, and it's in collaboration between Providence Healthcare, BC Renal, BC Transplant, and the Kidney Foundation. And it was recognized with an award of merit earlier this year at the BC Healthcare Awards. Ex vivo lung perfusion technology, which you can see pictured here, has just begun at Vancouver General Hospital a few weeks ago. And transplanting hepatitis C positive kidneys, which we'll hear about later today in one of the plenaries, was launched at the beginning of the year with great success. We continue to steadily add hospitals who have the capacity to do donation after cardiocirculatory death in the province, and several patients who have elected to undergo MAID have had the opportunity to donate organs and save lives, and something very comforting and meaning to them because it is first-person consent, and certainly to their families. So as a result of all of these changes, we've witnessed a significant increase in the number of deceased donors that we've had over the decade. In 2017 and 18, BC had a deceased donor rate of 24.9 donors per million population. That led the country in 2017, and we're still waiting for some of the provinces to report, but we're confident we'll also lead the country in 2018 too. The result is more transplants. While the numbers have gone down a bit in fiscal 18-19, the overall trend is still very positive. Last year, there were a total of 484 donors in British Columbia. This is a breakdown of the 484, total of 327 kidney transplants, including 3 combined organ transplants, a record number 27 heart transplants, yet there are 599 patients at date still waiting for kidney transplants in British Columbia. This graph shows a number of renal transplant patients followed in British Columbia. I think it sums up the great work that's been done and translates into better care for patients. Since fiscal 2015-16, we've added more than 550 additional kidney transplants recipients in the province. As of last week, there are 3,573 transplant patients receiving care throughout the province. I think it's a real testament to the incredible work that's done right across the whole transplant spectrum, from the pre-transplant care in the regional clinics in the province to the work of the transplant centers and the coordination and post-transplant teams, all working together to ensure best patient outcomes. There's a breakdown of kidney transplants by type. Living donation trend lines have remained constant, but the deceased donation has been the real driver behind the growth in the number of transplants. Translates into some pretty good news. Wait times are down for all blood groups. For blood group O, wait times have more than halved since 2010. In 2010, O blood type patients would wait on average almost 78 months or 6.5 years. In 2018, that dropped to 34.7 months or just under 3 years. This graph shows the median wait time in months. It's been trending downward. Again, great news for transplant patients on the list. Back in 2009, when we had 32 deceased donors, patients waited on average 5 years for a transplant. In 2018, the average wait time was 33.4 months or 2.8 years. With the introduction of the National Highly Sensitized Patient Registry in 2014 for patients with a PRA of greater than 95%, we see that highly sensitized patients are now getting transplanted. These deceased donor kidneys and recipients are matched nationally, and kidneys are transported across the country for transplant. In 2018, 17 BC HSP patients received kidneys, and since the program's inception, 77 BC HSP patients have received kidney transplants. So I think this really sums up the success of these great partnerships. This year we celebrated the milestone of 5,000 British Columbians alive today because of organ transplantation. In fact, the 5,000 transplant recipients received a living kidney transplant. Many of you are directly involved in the donation and transplant journey of patients and families, and the success of that journey is possible because of the expertise, collective knowledge, and coordination of donation and transplantation within the province. I think everyone here can share the pride of being part of a provincial program that is one of the Canadian leaders in the field. We can only achieve these outcomes by working together. Our successes are shared, and what we've achieved is due to the work and commitment of healthcare professionals right across this entire province. Before I end, I think it would be remiss if I didn't remind everyone in the room to also think about their wishes for organ donation. I encourage you to take a moment to do two things. Number one, to talk to your family, and number two, to take 2 minutes and register. And what I'm going to do is, so to end, I'd like to leave you with this short video. It's part of our new ad campaign. It's just been recently released, and it's already had 42,000 hits on YouTube. So I'll end with that. Thank you, and enjoy the conference. So if you can play the video.